Hi, Angelique. How are you today?
I'm good.
Good.
Yeah.
Okay. So, what brings you in the office today?
Well, today I just wanted to talk a little bit about my mom. Um, as we talked about before, she's a paranoid schizophrenic, and you know, when I was younger, as I explained before, I never really had to deal with my mom because I was raised by my grandmother, and my grandmother she took care of most of that stuff, like making sure that my mom was taking care of, like monitoring her medications and making sure that she goes to her appointments on time. And now that my grandmother's getting older, the responsibility is kind of mine now, and the transition is kind of overwhelming for me. So, I just wanted to maybe see if you could help me out with that. You know.
Yeah, sure, we can discuss it. So, let's start by talking about the relationship between you and your mom. So, kind of describe to me what that is like in the present day.
Um. Well. Um. Me and my mom's relationship is a little it's kind of a strain on the relationship, but it's because I have gotten so comfortable without like talking to her, and like most of the communication between us is because she's like calling me or trying to get in contact with me. I don't really take the initiative to reach out to her sometimes, and I think that's kind of bad because I'm getting a little bit too comfortable with the distance, but I guess to answer your question, the relationship is just it's it's a little dysfunctional. I don't really like to be around my mother because whenever I'm around her, it's it's just things happen and it's like embarrassing. So um, it's a little dysfunctional.
So, what I'm hearing is when you're not discussing matters about your grandmother, you don't really have much communication with your mom at all.
Well, well, not really with my grandmother. Just period with like just the communication between me and my mom. It's a little off, and because my grandmother's getting older, I have to deal with my mom more, because my grandmother was dealing with her, but now it's like it's becoming my responsibility because she's getting old. So,
And you said that there's a sort of dysfunction in the relationship between the two of you. Can you go into a little bit more detail about that and your feelings about that?
um, well, let me see. I'm trying to think of like a situation so that you can get a clear idea of what goes on. Um, you know, she's like a child. Her mind is very childlike. So, one incident that happened, we were at the mall and I was getting my eyebrows done, and out of nowhere, she's like, um, Angelique, I have to go to the bathroom, right? So I'm like, okay, well, you know where the bathroom is in the mall. We come to the mall all the time. And, you know, then like a couple seconds later, she jumps up and she's like, oh my God, I gotta go to the bathroom like now. And I'm like, oh, I'm just, like me and everybody that's around, we're just looking at her like, okay. So she runs out into like the hall where, like in the middle of the mall, and she just pees in the middle of the mall. And this was during the summer, and she was wearing a dress, and she just peed in the middle of the mall, and it was just so embarrassing. And I just get tired of having to explain, you know, my mom's situation to people. So that was like an incident that was like very embarrassing for me. And another incident, because there's so many. um, uh, we were well, actually, last night we went to go see Beauty and the Beast at the DPAC.
Okay.
Yeah, it's a good show. We didn't get to stay the whole time because we had to leave. We got escorted out because my mom, you know, she was just talking so loud. I'm telling her, I'm like, you gotta be a little bit more quiet. Like there's people around, everybody's trying to watch the show. She's just so loud. But I think it's because she doesn't really get out much, and she doesn't. Um, like she's paranoid, so big crowds make her uncomfortable. So it's like when we do go out and we're like, you know, you know, like around these large crowds, she goes crazy. Well, not crazy. I don't want to use the term crazy.
Right.
I don't like that word. But she just gets very like antsy and agitated and just a whole bunch of stuff that I'm just not used to dealing with. And I guess my question for you is, how can I better handle these situations?
Well, the first thing I was going to ask is, have you tried discussing these matters with her? Like just sitting down with her
Yeah.
one on one just to
Yes.
see her standpoint on things?
Yeah, I talk to her about it often. Um, I don't. Well, I don't think that she can comprehend the things that I'm saying, because sometimes we'll have a conversation, and she'll switch it and ask me a question like, well, um, no, not even ask a question. She'll make statements like, "Oh, you don't like me," or she'll be like, "You don't understand me," or it's kind of like it's twisted, like like she doesn't understand why I don't understand where she's coming from, which I don't. So, but I'm trying to.
So what I'm getting is she feels like you're playing like the blame game.
Right.
And so, with that said, she tries to switch the subject, or not necessarily switch the subject, or just try to turn things around and project her true feelings
On
onto
me.
you
Right.
because you're, I guess, attempting to diffuse whatever is going on between the two.
Right. But it's very frustrating. Can I tell you another story?
Sure.
Okay. Yesterday we went out again. Well, not again, but I talked about it earlier. But before we went to the show, we went to eat. I forgot the name of the restaurant, but it's someplace downtown. It's very nice. And at first she wanted to sit and eat, but then when we got there, and I guess she saw how crowded it was, all these people, it made her very uncomfortable. So when we got seated, she wanted to leave. And it's just embarrassing for me because she's like, you know, um, like we're having this conversation in front of the waitress, and she's like, "Oh, I want to leave. I'm uncomfortable," and she didn't want to stay. And I'm asking her like, why doesn't she want to stay and eat? And she's just like, "Oh, she doesn't want to stay and eat because she thinks that if she eats the food, it's gonna get her sick," and just all these things that and it was just embarrassing for me. Like every time that we're together, it just always seems to be like a moment where I'm like uncomfortable or embarrassed. Like we can never go out and just have like a normal like mommy daughter day. So
Is there anyone else in your family that you've spoken with
besides my grandmother,
about your mother, your grandmother or uncles, aunts?
I mean, I talked to my friends about it.
And what are their viewpoints about?
Their viewpoint, um, it's like half and half, because some of my friends think that I'm being too harsh. Other friends, they're like, they understand where I'm coming from, but um, they don't really have anything to tell me because they've never dealt with someone who is, a schizophrenic. So it's like half and half. But it's, the person that I mainly talk to is my grandmother, because she knows a lot about it, because she's been the one who's been taking care of my mom for like some time now. So that's really who I talk to about it. Majority of the time, it's my grandmother.
So it sounds like your grandmother is someone who you hold close to your heart. Um, and you said you've attempted yourself to try to you know sort of resolve things between you and your mom, what do you think are some alternatives to that?
What, to talking to my mom?
Yeah.
Maybe, well, since talking isn't working, maybe I could, like, assist her to her appointments. Maybe I can, well, I don't live with my mother, so maybe I can call and make sure that she's taking her medication, like kind of
Okay.
monitor it. Um, I could probably spend more time with her so that, I can become more comfortable with, like, the behaviors and the things that are going on. That's all I can think about right now.
Well, that's some really good starters, you know. Since you know that your mom is dealing with the situation, and I'm pretty sure it's just as hard for her as it is for you. You know, that could be the foundation that you have, you know, for to rebuild that relationship with one another. You know, taking her to her doctor's visits and just checking up on her for appointment, you know, to make sure she's going to her appointments and things like that. So, um, I feel like that could be, very helpful. So, is there anything else that you would like to elaborate on about your mother today? Or about anything
Anything
in
else?
particular?
Um, well, again, my grandmother's getting older, so um, is there any way that you can prepare for, like, if something that was to happen? I mean, God forbid, you know, she is getting older. She is. I know she's not going to be around all the time, and I guess what steps can I take to make me more comfortable, or you know, just to prepare me for what life is going to be after she's gone.
So is your grandmother really sick?
No, I mean she's a diabetic, but nothing, no like serious, um, like health conditions or anything like that.
How old is your grandmother?
She's 70.
Okay. So still fairly young, but not too old. You know, so
Right,
kind
right,
of
right.
kind of in the
Kind of in
middle,
between,
kind
yeah.
of in between there. So I know you said you really have a good relationship with her. Have you by chance spoken with her about what's going on with her as far as her health is concerned
Yeah,
and
all the time.
everything?
I speak to my grandmother like every day,
Okay.
every
Um,
single day. It's just I guess I'm so dependent of her because you know I've never been on my own before. Like she's always been there to hold my hand, and now that I'm like out of the house, things are like different. They have shifted, and like I'm still learning things, and she's still there to hold my hand. But I want to be able to um, be independent enough to where if something was to happen to her, I will be able to like fend for myself and take care of myself without having to like you know be like, oh my God, what's my grandma? You know.
um, so what else do you think besides talking to her would help?
Maybe doing little things on my own more. Like, um, for instance, like when she goes food shopping, she'll like buy little things for me,
Okay.
and then I like just go to the house and pick it up.
Yeah.
So maybe I can like do little things like go food shopping for myself and not depend on her to do it. And she still does my laundry. Yes, my grandmother still does my laundry. So, like just little things like that, just to be more independent. Like go do my own laundry, do my own food shopping. Like just little, like small things like that.
So creating a sense of independence
Right,
for yourself.
right.
Okay. Um. Well, that sounds like a plan. So, is to kind of reflect over what we discussed today since we're running out of time.
Right.
So basically, with your mom, um, kind of have a strained relationship, but you want to make that better by making sure that she's going to her appointments and possibly going to appointments with her.
Right.
And with your grandmother, you want to create a sense of independence for yourself by, doing things for yourself instead of having her do most of those things for you.
Right.
So, um, I think that will be all for today.
Thank you.
Let's wrap it up for today. I hope everything was helpful, and we'll discuss things further next week.
Okay, thank you so much.
You're welcome.